Hi, I'm Sanj Sukumaran, Doctor of Audiology and Clinical Director at the Ear Company. Today we're talking about the actual hearing test. For those of you who've never been in a hearing booth, this shot right now is actually from inside of a hearing booth to give you a little bit of perspective of what it's like to be inside of one. Now the hearing testing booth is actually a soundproof booth. We want a soundproof booth for hearing testing because we want to know what your best hearing is. When you come in for a hearing test, your clinician is going to ask you some questions relative to your hearing, things like your history. Did you have ear infections? Have you ever had surgery on your ears? Do you have ringing in the ears? Do you have dizziness problems? Those kinds of things. What is your recognition of your own hearing ability? Those kinds of things. What we're trying to do when we're doing hearing testing is we want to know what your thresholds of hearing are and how the structure of your ear functions. Quite simply, the questions we ask are relative to those responses. This is an audiometer. This is our primary piece of equipment, and it allows us to test your hearing in a very calibrated manner. But typically, when you first come in, one of the first things we do is we'll take a look in your ears, assess the structure of the ears, make sure you don't have a plug of wax in there or a hole in your eardrum or anything that might be pathology related. We want to look at the function of the eardrum, make sure it's functioning well and it's working well from a structural standpoint. But then what we really want to do is we want to find out what the quietest sounds are that you can hear across a broad frequency spectrum that represents primarily speech. So when we do that type of testing, we're doing what we call threshold testing to see what those quietest sounds are. So you would typically go into the booth and we'd put earphones on your ears, and we'd ask you to respond to us by pressing a button perhaps when you heard a beep or a warble, that kind of thing. And thereby we would sort of map out your hearing across the frequency spectrum to see within the range of normal and compared to the standard, where do you fall as far as your hearing goes. Once we find that out, we would sit down with you and break it down for you and just communicate what your hearing actually is relative to a very specific standard of assessment. That's the basics of a hearing test.
All About Hearing is brought to you by the Ear Company on Lansdowne Street. The Ear Company, your best choice for better hearing.